who's really running public health? That's the question. Is it Trump, the states, the system? Alright, Detox fan, let's get into it. Everybody's talking about health budgets, government spending, and Trump moves, but nobody's breaking down the real game. So let's cut through the noise and get to the facts. Trump's administration believes health agencies are bloated, wasting taxpayer money in programs that don't work. His team slashed $11 billion in public health funding, arguing states should decide their own priorities, not Washington. Now, instead of a one-size-fits-all health policy, states can allocate funds based on their own needs. And Trump wanted less federal interference, saying local governments understand their populations better than distant bureaucrats. And his plan includes restructuring the Department of Health and Human Services, the HHS, to shrink federal control and push back to the states. Now, on the surface, this sounds like a win for local governments, giving the states ability to fund programs that they believe matter most. But what happens when states don't prioritize health funding the same way? What happens when a national crisis like a pandemic, opioid epidemic, or mental health crisis hits hard and states don't have the resources to handle it? That's where the critics push back, and they push back hard. Public health experts ain't feeling it. Opponents argue that cutting federal health budgets could lead to serious risks. They say public health issues won't stay inside of state lines. Things like pandemics, mental health crisis, and opioid addiction hit nationwide, not just one region at a time. Cutting federal funds weakened pandemic preparedness, leaving some states struggling during COVID. Mental health and disease prevention programs lost funding in states that couldn't replace federal dollars fast enough. And some states sued the Trump administration, claiming that cuts violated federal law and put millions at risk. One big concern is that not all states have the same resources. Wealthier states like California or New York might be able to adapt and fund health programs independently, but states with smaller budgets or rural populations to be left struggling. And when crises hit, federal funding helps to stabilize the response nationwide. But critics also say that federal oversight ensures fairness, so lower-income states don't end up worse off just because they don't have huge budgets to spare for health care. So what's the big debate? Less federal control versus keeping the system balanced? Where Trump supporters say states should have full control. No DC interference. But critics say public health issues ain't local, they're national. Public health crises don't wait on politics. When pandemics spread and addiction rises, when mental health breaks down, the whole country feels the impact. And some experts warn that cutting national oversight to make these problems worse for states that don't have strong budgets. So here's the real question, Detox fam. Does Trump's plan give states freedom or leave them underfunded and stuck when things go bad? And my final thoughts for my Detox fam? Alright, we covered it. Trump says states can handle it. Critics say it's dangerous and the debate is far from over. But I want to hear from you. Drop your thoughts below. Hit the comments. Let me know what you think. Should health budgets be state-run or federally managed? Like, subscribe, and stay locked in, because here at Political Detox, we bring you all the real breakdowns no one else is talking about.